is Bindu. In today's video, let's see about leukemia cancer, symptoms, types, causes and risk factors. Leukemia is cancer of the body's blood-forming tissues, including the bone marrow and lymphatic system. Many types of leukemia exist. Some forms of leukemia are more common in children. Other forms of leukemia occur mostly in adults. Leukemia usually involves the white blood cells. Your white blood cells are potent infection fighters. They normally grow and divide in an orderly way as your body needs them. But in people with leukemia, the bone marrow produces an excessive amount of abnormal white blood cells which don't function properly. The WBCs are a vital part of your immune system. They protect your body from invasion by bacteria, viruses, fungi, abnormal cells, foreign substances. WBCs are mostly produced in the bone marrow, but certain types of WBCs are also made in the lymph nodes, spleen, thymus gland. Once formed, WBCs travel through your bloodstream and lymphatic vessels to fight infection in the body's tissues. Let's see the symptoms. Leukemia symptoms vary depending on the type of leukemia. Common leukemia signs and symptoms include fever or chills, persistent fatigue, weakness, frequent or severe infections, losing weight without trying, swollen lymph nodes, enlarged liver or spleen, easy bleeding or bruising, recurrent nosebleeds, tiny red spots on your skin, excessive sweating, especially at night, bone pain or tenderness. The types of leukemia. The onset of leukemia can be acute or chronic. In acute leukemia, cancer cells multiply quickly. In chronic leukemia, the disease progresses slowly and early symptoms may be very mild. Leukemia is also classified according to the type of cells that is affected. Leukemia involving myeloid cells is called myeloid or myelogenous leukemia. Myeloid cells are immature blood cells that would normally become granulocytes or monocytes. Leukemia involving lymphocytes is called lymphocytic leukemia. There are four main types of leukemia. Acute myeloid leukemia. Acute myeloid leukemia can occur in children and adults. According to Surveillance, Epidemiology and End Results Program of the National Cancer Institute trusted source, about 20,000 new cases of AML are diagnosed each year in the United States. This is the most common form of leukemia. The 5-year survival rate of AML is 29.5%. Let's see about the acute lymphocytic leukemia. Acute lymphocytic leukemia occurs most trusted source in children. The NCI trusted source estimates about 6,000 new cases of all are diagnosed annually. The 5-year survival rate of all is 69.9%. Chronic myeloid leukemia. Chronic myeloid leukemia affects mostly in adults. About 9,000 new cases of CML are diagnosed annually according to the NCI trusted source. The 5-year survival rate of CML is 70.6%. Chronic lymphocytic leukemia. Chronic lymphocytic leukemia is most likely to affect people over age 55. It is very rarely seen in children. According to the NCI trusted source, about 21,000 new cases of CLL are diagnosed annually. The 5-year survival rate for CLL is 87.2%. Hairy cell leukemia is a very rare subtype of CLL. Its name comes from the appearance of the cancerous lymphocytes under a microscope. Let's see the causes. Researchers do not know what exactly causes leukemia. However, there are some risk factors for developing the cancer. Some of the risk factors include previous chemotherapy or radiation for other types of cancers, genetic disorders like Down syndrome, other blood cancer disorders, repeated exposure to the chemical benzene, which is found in cigarette smoke. Let's see the risk factors for leukemia. The causes of leukemia are not currently known. However, several factors that may increase your risk have been identified. These include trusted source, a family history of leukemia, smoking, which increases your risk of developing acute myeloid leukemia, genetic disorders such as Down syndrome, blood disorders such as myelodysplastic syndrome, which is sometimes called pre-leukemia, previous treatment for cancer with chemotherapy or radiation, exposure to high levels of radiation, exposure to chemicals such as benzene. So, this is for today. We'll know about the diagnosis and the treatment of leukemia in the next video.